Hello and welcome to the Queen Elizabeth Patient Podcast. We're at the Proto Building in Gateshead. My name's Caroline Tweedy and I'm here to present a podcast about the chemotherapy services at the Queen Elizabeth Hospital. We have two of the key people who help manage and deliver the services within the chemo department. We've got Michelle Hughes. She leads the service and has got many years of experience. And we've also got Claire Pounder. She's one of our acute oncology nurse practitioners. And they're here today just to do an introduction about the services. So Michelle, can you just tell us a little bit about you and the services available within the unit?
So my name is Michelle Hughes and I've been a member of the team since 2003 at the Queen Elizabeth Hospital, primarily on the chemotherapy day unit, and I have a very posh title, but it basically means I'm the manager of the chemotherapy unit. So I'm responsible for everything that goes on within the running of the department, seeing patients, strategic decisions. I have a budget to manage, but I'm also part and parcel of the organisation, how we manage the care and production of chemotherapy drugs on site and anything that goes around that service.
That's fantastic. And obviously you have had quite a rocky start to the year with COVID and everything, but you know, you're going through the process now of coming out the other end of that. So we'll talk a little bit about that a little bit later on. But we've also got here Claire Pounder as well, who's also a member of the team. So Claire, can you give us a little bit background information of yourself and the role that you play alongside with Michelle?
Yeah, so thank you, Caroline. I am currently leading the acute oncology team at the QE hospital, and I've been in post for a couple of years now, and I've had an extensive background in as a cancer nurse for about 16 years and 31 years at the Queen Elizabeth Hospital, and obviously working with Michelle and the rest of the chemotherapy day unit staff to ensure that we offer expert advice and support and liaise with the wider oncology team and the tumour site specific teams in order to make sure that those patients who are having problems either related to their cancer treatment or their actual cancer itself are supported appropriately during their time in hospital.
So obviously you provide a wide range of chemotherapies, and not just for one cancer site. I imagine there's quite a lot of different cancer sites, and attached with them will be different treatments. But for overall, if a patient's been referred to the Gateshead chemotherapy unit, what would they expect once that letter comes and the first appointment's given when they come to the department? Where is the department?
So the department currently is in a new location within the Queen Elizabeth Hospital, which is in the Tranwell building, which is apart from the main hospital. But when you refer to the chemotherapy unit, it means that you've already seen a consultant and you've been given your diagnosis and been told that you're going to have some treatment. And they then ask us to get in touch with you and schedule an appointment for you to come to the department. And when you come to the department for the first time, it's not for treatment, it's to talk to you and to explain to you what the treatment involves, what you might expect, to introduce you to the environment, because it's quite an unusual place to come to, and people have a lot of preconceptions about what a chemotherapy day unit looks like. And then we will talk about your treatment and we'll explain any sort of potential side effects that you might experience. We'll give you information on do's and don'ts, where you can go, what you can do, what you can eat, and general advice on lifestyle. But most importantly, when you come to the unit for your first appointment, we're going to talk about what to do if you become unwell and who to contact and how to get the right and the most appropriate help for that problem.
So Michelle, when patients come along to this first appointment, how long would that sort of appointment generally take?
I would expect that you would be on the department for about an hour to an hour and a half. Now, that's not set in stone. Some people we can talk to and they're quite happy with a much shorter visit. Other people, it depends how many questions you've got that you want to be answered or how many concerns you have. The appointment really is about you. It's as long as it needs to be to make sure that you've got all of the information that you need, so that we are making an informed choice about the treatment that you have and you understand what we're doing. I think it's much easier for patients to have treatments, something that's as daunting, as scary as chemotherapy can be, if you understand what we're doing and why we're doing it and any potential problems that we might expect to happen.
And obviously this podcast is getting recorded in September 2021, and we're just kind of getting into the recovery process following COVID. Currently, what is in place with regards to, patients bringing a family member along? Is that an issue at all?
So pre-COVID, my department was quite often likened to a bit of a coffee shop where people came for medicine. It was a very open place. We had lots of visitors came on, or people came with a partner. I've met children, I've met grandchildren, I've met significant others, I've met parents. Unfortunately, because of COVID, we had to protect our patients because you're all very special to us, and it's a unique circumstance because we might affect the way your immune system works. So we have had to limit the amount of people that come onto the department. And originally when lockdown happened, we stopped everybody from coming onto the department apart from patients, and it was to keep everybody safe and for it to be a safe environment. As the lockdowns have eased and as the vaccination programme has gone on, what we've done is we've allowed patients to bring partners in or significant others or a friend for their first visits. So they've got support there when they're coming on the department for the first time, because that is a big thing. Coming onto a chemo unit for the first time, it is an enormous experience. We do ask now that if we can get away with it, that you might not bring somebody with you, and that's really to keep everybody safe. But the new unit that we moved into, it was slightly smaller than the unit we were on pre-COVID, and there isn't as much space. We are rectifying that now. We've got a nice new building coming on. There's a lot of refurbishment happening, and I'm hoping that in the coming months, as we get on top of what's happening with COVID, it's going to become more the coffee shop that I like and that patients like, and that it's going to be a much more relaxed environment. We might all still have to wear the masks, which makes it a little bit of an impersonal experience, but I am hoping that the environment will relax slightly.
So there's a lot of great things going on and developments within the unit. From a practicality point of view, from like parking, so if people aren't familiar with the QE, is parking okay with getting in for that appointment?
So what I'm very proud of about Gateshead is very patient focused, and we do make sure that when patients come to the department that there is parking available there. The car parks too get busy. Where we are now, there's a parking area outside of the department which is allocated just for patients, which is a really good thing. So it's much easier. You don't have far to walk. You can literally be dropped off at the door. And because you're a patient on the chemotherapy day unit, you don't need to pay to park on site at all within the Gateshead Trust site. So that takes away the need for you to have to find a pay machine, to have to find somewhere where you've got to walk a long distance, especially if you're not feeling very well. You can get right up to the doors. It's much easier.
That's great news, because obviously we know that getting a diagnosis of cancer can be very expensive. So if that's maybe one less cost. Obviously, if patients are travelling from further afield, we do have Macmillan grants to help with transport costs as well, which your key worker or the Macmillan Centre, which is based in the purple zone, can also help with as well. So the patient has been for the first assessment and they understand a lot more about what process they're going to go through. So if they don't get their chemotherapy on that day, would they then expect to get an appointment so they know exactly when to be coming for that actual treatment to start?
So when patients receive their first appointment to come in for their visit to talk to us so we can meet them and explain what we're going to do, on the letter that they get for that appointment, they will also have a list of appointments, so they have them in advance of coming to the department for the first time. There will be dates and times on there, and there's a telephone number on there where they can ring and they can query about any dates and times, but the appointments are generated in advance so that they know exactly when they're going to be treated and when they'll be having their treatments, and so they can organise transport, things like that if they need to, and they can ask loved ones to book time off if necessary if they're being brought to the unit.
The great thing about the unit is, that they're flexible where they can, because obviously we've got patients with children and school pickups and elderly parents and some. So I imagine there's some flexibility as well. Is it a matter of just asking if sometimes the times are a little bit difficult for patients?
Yeah, that's fine. I mean, but we're all about the patients. We do have a service to run, but we're all about the patients, and if we can help and make it easier, we will. Obviously, we can't get everybody's appointments at 10 o'clock in the morning. It's not possible. There's too many patients, unfortunately. But if you've got any concerns or any circumstances that worry you, just ask. If we can help, we will. But if you don't ask, we don't know, so we can't help.
Yeah, and then it's an extremely busy service as well, and as well as come with the expectation that sometimes, you may get an appointment for a certain time for a certain treatment starting, but, with everything, sometimes it can run behind, and I suppose it's taken the pressure off the patient, knowing that, if you've got kids to pick up, maybe have a plan B if that treatment's maybe running behind. Is that something that you would maybe advise?
So we don't have any of that explained on the first letter, but when I meet patients for the first time and we're explaining about their treatment, I quite often talk to them about what would happen if you were unwell, especially if you're a mum, a working mum, or you've got children, or you've got dependent family members. It's a little bit like being pregnant in that we tell you to have a plan B so that if something goes wrong or you're not well and you can't make an appointment, that somebody else can help out. So definitely when you're having chemo, that's always something that's worth thinking about. But when it comes to appointment times and days, we can move things around. That's absolutely not a problem. But as I say, if you tell us, we can do something about it, but we can't if we don't know.
So Michelle, obviously that very first appointment to discuss the chemotherapy and what to expect, but I think as well is obviously the information that they'll get with regards to contacting people and who to contact and when to contact. Is that information given verbally and I imagine written form as well?
So we always give you information about how to get help, and you have telephone numbers and contact details of how to get help. But one of the things that's really important that I always stress is that if you're not well, you should seek help. And what we're very fortunate with at Gateshead is that we have a 24-hour helpline. Monday to Friday, the helpline is answered by the nurses on the chemotherapy unit between 8 o'clock in the morning till 8 o'clock at night. Now, we don't have any oncology beds as such at Gateshead, so we don't have nurses that work night shift that work on the chemo unit. But what we do have is a team of specialist nurse practitioners who have a lot of knowledge and a lot of experience in looking after patients who become critically unwell. And when you ring the helpline after 8 o'clock at night or through the weekend, you'll get through to these nurse practitioners and they will ask you lots of questions. And they will then make a decision in exactly the same way as the nurses on the chemotherapy day unit would about the care or the help that you need. Now, they may say to you, wait till the chemo unit's open and speak to the team the next day, the next working day, if that's appropriate. They might say that you need to see a doctor, or they might suggest that you call 111. But if they're really concerned about you, what they're going to do is they're going to give you advice to come into accident and emergency. And that is similar to the advice that the nurses on the chemotherapy day unit would give you. And one of the reasons we tell chemo patients to go to accident and emergency and not a GP service or a GP out of hours service is because you probably need your blood to be taken, and the quickest and the easiest way to get a blood test taken and to get the results back straight away is to go through accident and emergency. And we would always tell you that you should go to your nearest accident and emergency. When you're having chemo, if you're not well and you need to be seen, you should never drive past a hospital or a place of care to get to somewhere that you think might be a better place to go.
So it's acting quickly as well, because I know some patients think, are they overreacting? Especially for the first one, it's that kind of, is this just normal, or is this something I do need to report? What would your advice be to those patients who think they may be overreacting?
So I would always tell patients that they should ask, and it doesn't matter to me how small or how trivial the problem or the concern is. You're going to be much happier at home having treatment if you're not frightened. And if you're frightened of something that's going on, or you're not sure if it's something that should be happening, you should ring us and you should ask. And we're never going to complain about you asking. I always prefer patients to ask. You can ring every day if you need to, and we'll answer your concerns. That's not a problem. But basically, if we don't know about it, we can't help. And that's the difficult thing. And as a nurse, there's nothing worse than getting a phone call to say that somebody's been at home poorly for a few days, and actually they've been admitted to hospital when we could possibly have nipped it in the bud, given you some advice and some support or some treatment, and avoided that unnecessary admission. But if you are poorly or you're unwell, and even if it's just that you're not sure, you should ring us. And that's what the service is there for. If you don't ring us, we're not doing our job.
And sometimes I think probably the advice would be to do that early on rather than maybe kind of just hanging on and hope maybe symptoms kind of settle down. Would that be advisable to do?
Oh, absolutely. I'm much more comfortable with patients that ring me up and tell me that they're not feeling well than the patients that worry me who sit at home and who are poorly for a couple of days and then problems get worse. It's much better, much safer, and it's a better experience for everybody if you ring us. And as I say, most things we can help with, but we need to know about it.
And basically nip it in the bud as early as possible. So, Michelle, Claire, we've talked about the helpline, but I just thought it would be really informative from a patient's perspective of what happens when you ring that number. So we've got the lovely Nicola George here, who went through his experience approximately, was it a year ago, Nicola? So can you give us a little insight of what happened when you contacted the number when you were having your chemotherapy?
Yes, I've contacted the emergency number twice, several times, but both of them, so the daytime one emergency number and the nighttime one. So the daytime one is manned and staffed by the chemo ward. The evening one is staffed by some out of hours that aren't on, I don't know who, but it's not the chemo ward. My experience of the daytime ward is I would ring them if I was concerned, if I was worried, if I felt ill, but as well as needing a little bit of reassurance. I know the staff, so if they pick up the phone, I'll say, oh, is that Michelle? Or, is that so-and-so? Am I being dramatic? Am I okay? Do I need to come in? And then they'll say, well, maybe you should come down and we'll just take your blood pressure, or, we'll take some bloods and things like that. And it was great because I was put at ease. I've rang the night time. I've had a great experience of ringing the night time. I was very poorly. I come in, I had to go to A&E, but I wasn't, made to wait in A&E. I was put in a separate room. And thankfully all I needed was fluids, and after a couple of hours of fluids I went home. But I think the difference with ringing on the evening is that I didn't know that team, so maybe I waited until I knew I was very, very poorly before I rang the evening team. So both positive experiences, but I would just say I was more likely to be confident to ring the daytime emergency team because I felt as though they knew me. But yes, no complaints or anything about the evening team, but I think I would definitely wait on an evening to be thinking I was really on death's door before I would call, because I knew that they would then have to really assess me. It's like kind of ringing 111, isn't it? You really need to know that these people are going to assess you along the line without ringing someone and saying, please just listen to us and let me see that these symptoms are like, without having to answer a ticky box question, So
if there's a patient out there who was thinking, oh, shall I not? What would your advice be?
I'd say absolutely all along, if it's on the daytime, and yeah, absolutely.
And you got the reassurance?
Yeah, absolutely, yeah. And I was never ever turned away, ever. I was never made to feel silly. I was always told, if they thought sometimes I was being over dramatic, which, I am sometimes, and you are. Having cancer makes you that way. They would say, like, let you see how you are. Give it a couple of hours, and if you're still the same, come straight down. I was always given practical advice, but never made to feel as though I was being silly or anything.
And I thank you so much for giving us your insight and experience into the helpline. And I think it is important, as you say, and I guess you do get that reassurance, don't you, when you've got that relationship with the chemotherapy day unit staff. But certainly from the helpline point of view, I think it is important just to recognise for those of patients who are looking, starting out on their pathway in terms of chemotherapy and other treatments on the chemo unit, that we those that answer the helpline, regardless of whether it's in hours or out of hours, there's a standardised assessment process that the team have to use. So there's a standard approach in terms of, you mentioned before about there's lots of questions and maybe some ticky boxes, but there's a really robust process in terms of triaging people who ring the helpline. So everybody's asking the same questions. Obviously, they are going to have that little bit more of an insight into your own personal experience because of the fact that you're actually having the treatment on the unit. But I think it's so important that, if in doubt, just ring the helpline and not wait for the daytime staff to come in. Just ring the staff at night are really experienced, and they'll do their absolute best to help and support. And one of the things is there's so much communication that goes on, not necessarily always face to face. There's so many emails, phone calls. There's a lot of information or traffic that goes on behind the scenes in order to make sure that you're getting the right advice, right support, right treatment. And with even out of hours, there's the opportunity for the staff or the team who are manning the helpline out of hours to ring the on-call oncologists at Newcastle as well to get that expert advice if they feel that they need to get some oncology specific advice or some chemo advice that maybe they might not be familiar with. So they can ring if needed to make sure they've got the right information for you.
Yeah, I totally agree. The treatment, and the way they handled it is second to none. I was absolutely great. I just think I'm more likely to ring during the day because it knows more. But as for treatment wise and that professionalism, absolutely second to none. Just experience, I'm maybe bit more of a pest during the day.
It's probably more reassuring when it's somebody and it's
absolutely
something you're a bit more comfortable with, I suppose. So.
It's a great testament towards the service that you've actually got that relationship with the patients as well. And like I say, I've mentioned before, Nicola, that you actually said that you missed the service when treatment was finished, and again, I don't think you could get a better testimony. So coming on to you, Claire, if a patient does ring up and advised to go to A&E and some of those bloods have shown that they maybe need some extra attention, what role would then you play, Claire?
So in terms of the acute oncology team, as I said to you earlier, we work very closely with the chemotherapy day unit staff, and there's a number of processes that we have in the hospital itself in order to alert us to patients who are having chemotherapy or immunotherapy or the anti-cancer treatment. So we'll get an automatic flag on our electronic record systems to know that a patient has arrived in A&E, and obviously we closely monitor the situation, sometimes remotely or sometimes actually go to the actual department to review the patient who needs that face-to-face assessment. There's lots of dialogue between ourselves with the chemotherapy day unit and often with the patient's oncologist as well directly, so we can try and make sure that there's timely review, there's timely advice and guidance, and as Michelle has mentioned already, just to try and nip things in the bud, because there are occasions where patients do have to come up to accident emergency to have their bloods done. We've been reassured by those blood results, and we can give some advice and support about an early discharge home, but obviously being mindful of having to get in touch if you have further problems or symptoms. If you do have to be admitted to hospital, then acute oncology team will come and review the individual on the department and follow you through that journey. And obviously, as I said, closely liaise with the oncologist, with the chemotherapy day unit, and making sure that the advice and guidance is given appropriately according to individual need based on investigations and blood results, etc.
So Michelle, if the patient then, if they ring up and they then go to A&E, they get the bloods done, and maybe the bloods have shown that the best place would be there for them to be admitted to hospital, would they then contact the acute oncology services?
So what happens once the patient's been through accident and emergency, or if they're needing to be admitted because bloods are abnormal or they're unwell? There is an electronic flagging system in place whereby any patient who's under the care of the chemotherapy service, we get an email to say that the patient's been admitted, so we know what's going on. The emails come to myself on the chemo unit but go to the Acute Oncology service, and the Acute Oncology service is a service that runs alongside the Chemotherapy day unit, and they're specialist nurses who are specialist practitioners looking after the specific and unusual care and needs of patients that are receiving chemotherapy. What we do also get is that if patients are admitted to other hospitals around the North East and not just the Queen Elizabeth Hospital, we also have an acute oncology service there, and they will contact ourselves or the acute oncology team at Gateshead to advise that one of our patients has been admitted to their hospital. So the communication is very good.
Yeah, so obviously, as Michelle says, the acute oncology service has been developed as a unique specialty in its own right, and there's obviously acute oncology teams across the country, and that service has been developed to support patients with cancer who have to come to hospital as an emergency, and that could be, as Michelle's already mentioned, a complication from cancer treatment, symptoms related to the cancer itself, or because there's been investigations that have suggested that somebody might have a new cancer. Certainly in terms of the way that acute oncology services work across the region, we are able to work very well together. We liaise, we communicate. If patients do end up being admitted to other trusts in the region, there's always lots of dialogue behind the scenes to make sure that there's collaboration, there's communication, which is absolutely vital to ensure that information is shared and communicated in a timely fashion to make sure that the best care is provided and information is available to clinical teams through liaison with the patient's oncologists and the treating teams if patients are receiving treatment in other chemotherapy units outside of Gateshead. I think what's also important, and something that Michelle and I are, as experienced cancer nurses, I think there's always an element of anxiety, not least because of diagnosis and because of treatment and uncertainties around treatment. But I think certainly from an unplanned admission due to side effects of chemotherapy, I think it's so important that patients and their families know that there are, a specialist team within acute oncology working really tightly with the chemotherapy day unit to make sure that all the right people know about their admission, their oncologists know about their admission, and that as much information as possible is shared to make sure that they get the best care, the right care at the right time by the right people. And I think that is so important, and that's really crucial and vital part of acute oncology service within Gateshead, working closely with Michelle and the rest of the team on the chemotherapy day unit.
Because I think it's a time when patients are at the most vulnerable, and I can't think of anything more vulnerable if, feeling horrendous, if you've maybe had some really bad side effects, and then to be admitted to a complete strange environment, but to know in the background the cogs are still turning. My background is with breast cancer, and the emails that are going through over one particular patient, and it's not just the episode on the ward, it's when they get discharged home, and the dialogue that you would have with the specialist nurse to say, this patient has been in, and because coming away from the hospital ward after that experience is this kind of anticipatory worry of that next cycle. Will this happen again? What would your advice be to that patient that have had a especially tough cycle of chemotherapy?
To ring us and speak to us. We're not there just to give the medication. I mean, that's primarily what the chemotherapy service is all about. But the service is so much more. It's about supporting the patients. It's about supporting relatives. It's about making sure that they know that they're not on their own and there is somebody to speak to. And we have very good links with other services. We have links with nurse specialists for different types of cancer that patients might be having treatment for. We have links with psychology services and counselling. We can get information to patients about benefits and grants through the Macmillan Information Service at the Queen Elizabeth Hospital. The service hopefully is about the whole patient and the whole experience. And I think what I would also like people to understand is that we're not just responsible for your care, when you're on the department. We're responsible for your care from the start of your treatment all the way through until at least 8 weeks after you've had your last treatment cycle. And even if you rang me at 9 weeks, I'm not going to put the phone down and say you're not my responsibility anymore. There is always somebody there that can help or that can point you in the right direction of the right care and the right information at the right time.
I mean, Michelle had received a phone call yesterday from a patient, Nicola, who's going to come and do a podcast later today just about her experience. And she's a year on from her diagnosis, and she asked us, is it strange that I still miss coming to the chemo unit? And I said, in what way do you feel like it's strange? She went, I just feel like it should be something I should forget about. But going through that experience and then coming to an end, I felt like I had said goodbye to a family. And I just think, you know, to me, to create somebody to be able to say such a traumatic experience, but to actually miss it as well, because obviously the atmosphere that you've created, such a safe environment you mentioned, and the fact that you could speak to you and the team about stuff that you couldn't actually speak to people at home about. You felt like you could talk in that way.
That's an amazing thing for somebody who's been through such a terrible treatment to say. It is a real credit to the team. I might be the manager, but it's the team that provide the care more often than not. And we know what grandchildren are doing. We know when babies are born in the family. We know about family arguments and dynamics and what the dog's called, and that's just the nature of the team. As I said to you before, when people come to a chemo day unit, I think they have a picture in their head, which is often described to me, that might not be the most pleasant. It's a noisy place, it's a busy place, you'll see the same patients over and over again. It's a lovely place to work in, even though sometimes the stories are a little bit sad and people are going through a difficult time. And I think there's a lot to be said for us being mindful of what happens to patients once they finish their last treatment. It's almost an issue of survivorship and where do I go next and who's looking after me next. You know, we say goodbye to them, and I know for a fact that patients still think, well, who am I going to ring when there's a problem? What happens if I find something and I'm not sure about, or I'm worried about something? Services are always there. There's always a point of care. And if it's not something that we could particularly offer full time, maybe we can just point you in the right direction of the right service that can to give you that support. But it is quite a noisy place. There is quite often people dancing, which is a bit of a weird thing.
There's a lot of humour that goes on. There's a lot of, great conversation. I mean, there's people that, they do feel isolated, especially going through COVID, and they haven't had that contact with other people or other cancer patients, but equally there's patients that want to remain private and, there's options, isn't it, to have that treatment possibly where you can, in a side room, because there's some areas that are given in a larger room.
So we have a mixed accommodation at the moment. Our previous unit was 2 large rooms and 2 cubicles. The accommodation we have now is that we have 2 large rooms and we have about 7 cubicles for those patients that don't want to participate in some of the general madness and chatter that goes on. And sometimes you just want a quiet space where you can relax and just chill while you're having your treatments. I should imagine, and never having been a patient, it's quite intense. It's quite intense at home because everybody's looking at you wondering if you're okay and wanting to help. But coming to the chemo unit, sometimes if we can offer you a quiet space to find some headspace to get things back on track, that's absolutely fine. The journey and the experience is about the individual. As much as we can, we'll foster that and we'll support that.
So Michelle, when the patient's having treatment, and then they leave the department, I imagine there's still a lot goes on behind the scenes with regards to follow-up and aspects like that. Could you just expand a little bit more about that side of things?
I wonder if Claire would like to explain that, because her service picks up a lot of the follow-up for patients that have called the helpline if they're not well.
Yeah, thanks, Michelle. So from an acute oncology service point of view, as well as seeing those patients who do come in and have to be admitted to hospital, we also do the vast majority of the follow-up calls to the chemotherapy helpline. So we have a robust or streamlined process, and those calls are followed up the next day or the next working day. And as Michelle says, sometimes the reason for the call to the helpline has been resolved with the initial advice and guidance that's been given either by the chemotherapy day unit staff or by the the out-of-hours practitioners, nurse practitioners, but we always do a phone call just to be sure that the symptoms have resolved, and at that point we can offer signposting if there are other issues that need to be addressed, or indeed if things need to be escalated and a sooner appointment organised with the oncologist, or a sooner review on the chemotherapy day unit, or some further advice around medication or other information that might be required at the time. So as I said earlier, we work very closely with the chemotherapy day unit staff, and regardless of whether somebody's finished their treatment within the last 6 weeks, even if it is beyond that, as Michelle has already said, there are occasions where people do still ring because they're not sure about who to ring, and we will always try and help, support, give advice and guidance, or signpost appropriately, just to make sure that any those queries that need to be addressed and supported and hopefully resolved are done as promptly as we possibly can.
That's a great service, and like you say, it's so joined up, and the way that you both work together to ultimately improve the experience. I think hopefully the podcast today is given anybody that is awaiting an appointment to come along to the chemo unit that it's daunting, but the support out there is immense, and if you are struggling at any point with the treatment, I think Michelle and Claire have strongly said, the earlier you contact and ring them and let them know, the easier and the better the support and the better the outcome can be for yourself. But there's more information that you can get online through the Gateshead website and internet pages. You can get some information from there. We've got a Macmillan information service as well, which has got more information with regard to a lot of the individual treatments as well. But thank you so much for coming today. That's been really informative.
Thank you.
Thank you.